Okay, so this is wound management skills. You have a list of supplies that you will need. I am coming to the patient's room and I am phoning in to clean my hands and talk to the patient and tell them, Mr. Jones, I'm Jennifer from physical therapy. Today we are going to be looking at your wound, measuring it, cleaning it, and redressing it to try and help it heal. Are you having any pain right now? We can also decide if he needs to be pre-medicated or not. But also, you shouldn't feel any more pain with this. And if you do, please let me know. I'll be right back while I go get some stuff. The first thing I'm going to do is I'm going to clean my treatment area. So let's say this is a tray table. I want to make sure to spray it down and clean it. And I've already taken everything off of it. Okay, throw that out. I'm going to make sure I have a trash can right next to here, move it over. Now my hands are dirty, so I don't want to touch anything else at this time until I go wash my hands. So now I'm going to go wash my hands. If you recall, the correct way to do this is to soak 20 to 30 seconds. Make sure you do each finger, the backs of the hands. You've taken off your jewelry. You do under your nails. Rinse your hands off, pointing down. Make sure all the soap is off. Don't flick it. Take some towels. And then you're going to dry your hands so they're thoroughly dry. Throw that out. And then you're going to take a clean towel and turn the water off. Okay, now that I'm clean and my area is clean, I'm going to get my supplies. I'm going to go get my PPE. I've gotten my PPE here, and I've also put down a clean towel here and gotten my other supplies, which include some cleaning solution, whatever I'm going to use. I've got my Q-tip. I've got some dressings that I'm thinking that might work for this wound based on my chart review. I've got my tape, and I've also got some things to clean the wound with, some gauze. Okay, and I've also torn off some tape and gotten it ready for myself to be able to redress the wound. If I'm not sure, I'll need someone with me, like a tech or the nurse, to get me the tape if I'm dirty. Okay, so the next thing I'm going to do, I'm in the room, I've got my tray table, I've got my patient. I'm going to put my PPE on from top to bottom. I'm going to put my mask on. Any mask you have will be fine. Make sure that it's over my chin and that it's tight around my nose. Now I'm going to put on some eye protection since I'm going to be so close to the patient and irrigating the wound. Then I'm going to be putting on my gown, which in this case is a hoodie, turned backwards so that I can tie it behind me. Use the belly shot before that. This is just to show you. And then I'm putting on my gloves, whatever gloves you have that you're going to use for this. Okay, so next step, let's check out the patient. And I'm going to tuck something underneath their wound area here like I've done so that anything that drips off is going to collect on the clean towel versus on the patient's bed or their clothing or what have you. So I'm going to gently remove the dressing. And what I'm going to do is I'm going to peel the dressing away from the skin gently. No ripping, no tearing. So think about peeling actually the skin away from the dressing. Okay, nice and easy. Then I'm going to take it off and look at it and assess what drainage I see right now. And I just see moderate serous, it's a little yellow clear. Trying to smell an odor, usually you'll be able to smell it if you don't put it up to your face. I don't see any odor, smell any odor at this point. So we've got moderate serous exudate. And I'm going to say it out loud because I'll have somebody with me writing these down. Okay, so we want a tech or a nurse to write these down for us. So now I'm going to throw that away. And I removed 1 2x2. I want to note that as well. Okay. So I've assessed the type, amount, and odor. The next thing I'm going to do is I'm going to cleanse the wound. So I have my normal saline here. This is dedicated only to this patient. Again, this is clean. My hands are clean. Well, this isn't clean because it's going to be just with the patient and I touched the patient's wound, but it's just with the specific patient. So then I'm going to clean that with the patient. Okay, I'll take a 4x4 gauze, clean the wound on the inside to get any loose materials and clean off the exudate. Throw that away in the trash. And then I'm going to clean just the peri wound on the outside going out so that we don't get any of the skin bacteria into the wound bed. Okay, now that my wound is clean, I want to actually change my gloves to clean gloves since I touched the dirty wound. So throw these gloves away. Okay, now I'm redonning a new pair of clean gloves as I go to touch the clean wound. So I'm going to look at the wound characteristics. In this case, I can see that this is a sacral wound. Can't really see how deep it is because I can't see into the depths of the wound. It is 100, well, it's got some necrotic tissue right here on the side, you can see. So I've got probably 10% or 5% necrotic tissue and 95% viable tissue as far as the visible areas of the wound. And if this is my patient's head and this is their feet, we're going to measure in the clock method, right? So this would be 12 o'clock and this would be 6 o'clock. The longest is going this way. So it would be 10 to 4 approximately. So I'm going to take my disposable ruler and I measure in centimeters. We always measure in centimeters, not in inches, okay? So I'm going to measure the longest area from one edge to the other. Again, from about 10 o'clock to 4 o'clock. And I've got 3.2 centimeters length. And then I'm going to measure the width at the widest, which in this case is from 8 o'clock to 1 o'clock. And that is, and I'll show you this a little better here so that you can see it. So here's how I measured from the length. Whoops, doesn't usually do that. And then the width as such. So I'm looking at one edge, the edge of the wound bed to the other edge of the wound bed. In this case, I am including the eschar as part of this wound bed. So the width is 2 centimeters from 8 o'clock to 1 o'clock, okay? And then I also want to do the depth. So I can see that there's an area here of depth. So I'm going to gently prod in to see if I can get an end point. And in this case, I am getting an end point. And then what I do is I bring my fingers down to the base of the wound, flushed basically to the edge of the wound edge, the regular tissue. I'm going to take that out, and then I'm going to align it with the ruler and determine that measurement, which is 3.1 centimeters. Usually I do that down here, okay? So that's actually more like a tunnel. In that tunnel, if we're, again, saying that this is 12 and this is 6, is at 4 o'clock. So there's a tunnel at 4 o'clock measuring 3.1 centimeters. I don't see any undermining anywhere. There is maybe a mild depth if we look at the edge of the orange, and I just go to the edge and the base, and that depth is going to be 0.3 centimeters is the depth between the general base of the viable tissue or even non-viable tissue to the wound edges. Okay, so now that I've measured that, and I've already measured the tissue type, the length, width, depth, and any tunnels or undermining using the clock method, I want to tell whoever's writing this for me about the wound edges. So the edges are unattached from, I would say in this case, 3 o'clock to 11 o'clock, and they're attached from 12 to 2 o'clock. The peri wound is unremarkable because I've included this in the wound bed, right? So the peri wound is unremarkable or intact. I also want to look at the exudate and drainage now that I've cleaned the wound. Is anything coming off of it? I still only see serous. It's fairly moist, which is good. It's not dry, it's not wet, it's moist, which is what we want the wound to be. And any odor that I smell also at this point. So now I would also do any debridement that I need to do if I have orders for that and if it's appropriate for my patient, and throw away these tools. Okay. Now what I'm going to do is, you may or may not change your gloves again. Okay. I am going to get my dressings ready. So go ahead and change your gloves again. And I'm looking at the wound and I have some things I'm trying to decide, what am I going to use? Well, I do want to use something to protect this peri wound because there is some drainage. There's some skin prep that protects the peri wound. And it looks like it comes in like an alcohol swab type looking thing, except it's skin prep. So I'm going to open that and I'm going to rub that on the peri wound. And again, it just protects it from that moisture from the wound. Okay. Okay. I'm going to throw that out. Okay. And now I know that I have a little bit of a hole there. So I do want to fill it. Okay. So what do I need to fill it? I could use a small rope, like an alginate rope, because it is moist, so that'll absorb some of the drainage. I don't need to add moisture to the wound because it is moist enough and it had some exudate. So we can do something that's kind of absorptive. So I have two options that I can use this rope alginate, or I can use a 2x2 alginate. To make it easier for y'all, open this and we can use our 2x2 alginate. Okay. Now, because the wound is moist, we do not need to wet this because it's going to help absorb the exudate and it will get wet itself. Okay. And then I also have this, I need to pack it. So I have a Q-tip that I'm going to use and get. So, not the one on the floor, obviously. This is simulated. I had two. This one's clean. And what I'll do is I'll gently pack this. I can open this 2x2. That's usually 2 or 3 ply, meaning it's more than one layer. And I can have it form however I want it to form. Okay, so then I'm going to push that in to the end of this tunnel. Once I get it to the end, and I don't want it packed tight, I'm going to pull it back just a tad bit so I make sure it's not too tight so the granulation can grow in. Then I am going to cover the rest of the wound bed with it if there's some left. Okay, and it looks like I need another piece of this alginate. So in this case, I might fold it over and place it over the rest of the wound bed. Okay, so that's my primary dressing. And then my secondary dressing, be it I need it to absorb, do I need it to protect, all of the above. So I may use some sort of foam or some sort of gauze or something on top. And I want it to cover everything. So I'm going to put this 2x2 over that. If I needed larger, I would use a 4x4. And I'm going to use my tape or have my assistant do the tape and adhere it to the intact skin, right? In a window pane fashion, all the way around. If it's not already adherent, some of the dressings are adherent on the edges themselves. And this one is not. All the way around, make sure we're good here. Sir, are you doing okay? Yes, ma'am. You almost done there? Yes, sir, I am. Looking pretty good. We just need to keep that area clean and change this dressing, and we need you to eat well, and we got to keep the wound moist so it heals well, but make sure you do your part in eating and staying off that wound, okay, so that it can heal. Yes, ma'am. Okay. All right. Well, we will see you tomorrow. And so I'm done with this wound. I'm going to have the patient get off this and just back on there. What do you call it? Throw out anything I've used. This is a towel, right? So I'm dirty now. This is dirty. I'm going to put this into the dirty linens. Okay. And then what I will do is take off my PPE because anything that I've already touched that was dirty, I've thrown away. So I didn't touch any of that stuff. I touched this stuff, so this will need to be thrown away. So you may want to take some out ahead of time. I'm throwing this away. Okay, I didn't touch any of that with my gloves. And if I did, because I know I picked that up and showed it to you all, but if I did touch it, with my dirty gloves, then I would have to throw it out, okay? Okay, so now I'm gonna remove my PPE, okay? Now remember, I've got my thing on here, and I'm gonna pull to get it off. And then I'm gonna roll it up and take my gloves off as I roll it up and away from me. Take my mask off like so and throw that out. And take my glasses off like so and throw that out. Okay. Then what I'm going to do is go wash my hands in the appropriate manner for the appropriate amount of time. Come back. Again, this is the treatment table, and this stuff is clean, but it still needs to stay in the patient's room. So I'm going to go put that in a designated area in the patient's room to reuse it next time. I'm going to take my towel and also throw that in the linens. And then I'm going to foam out. The last thing you do want to do that I did not do is usually you want to write with a Sharpie designated to that patient's room the date and your initials on that dressing after you've done it, before you've taken off your PPE, okay? Then you can use an alcohol swab and clean that Sharpie off after.